Okay, I'm back because I think you guys are asking questions. I'm really sorry I can't see your questions. So I'll request somebody to share me what are the questions, or you can ask your questions here on WhatsApp. So I'll answer your questions. Okay, just hold on till I share my video link. Okay, honestly, what are your questions? Let me type it. What are your questions? If you can see this, what I've typed is what are your questions? You can reply over here, or you can ask your questions. I'll also try to see, because I can't see any of your comment over here. I don't know why, but honestly, I've not seen a single comment. Okay, so yes, please. I got it. It's just on the right side. So please explain the modes again if possible. I'm really thankful for this information video. Okay, Zani Malik, just give me a moment. Let me share the link again. Uh, Students, you just have to wait just 1 more minute or 2 minutes, because let me share this information with all others, and then I'll answer your questions one by one. Okay, so I need to share this with others as well. First of all, thank you very much. You've been listening very actively and with patience. So, okay, I'll answer your questions. Please explain the modes again. Okay, there are different modes, but the most important modes are basically the burst mode and the normal mode and the modulation mode. So, burst mode, there are different pulses or train of pulses that are coming. Let me log out from here because you guys are asking a lot of questions, so my internet is turning very slow. uh, okay, so the burst mode, the normal mode and the modulation mode. For burst mode, there are different pulses that are coming at a frequency of anywhere between 1 to 5, and normal mode you can select any range of frequency or intensity and pulse width, and for modulation as well. So the modes, if you go back to my video, you can see for burst mode it is applied in subacute and chronic conditions. For normal, it is usually applied in acute conditions, and modulation, it is applied in chronic conditions for longer period of time. Some of the patients were complaining after placing TENS that they feel muscle tension around electrodes. What the phenomena is? Okay, the reason behind why muscle tension is because you are not applying TENS with using, you can say, appropriate intensity. Your intensity needs to be high. So it is basically high, you need to reduce it. One other thing that you can do is always try to choose a larger electrode size, because if your electrodes area is small, then the charge is going to be condensed onto one area, particular area. So that is the reason the patient complains of tingling sensation, or you can say throbbing sensation or tense sensation. Sir, it's very informative. Thank you very much, Namra Gul Bhatti. Asha Farooq, sir, what is the dosage for the chronic knee pain? Okay, there is absolutely nothing established. So, what is the dosage? But if you want to reduce the pain, for example, if a patient is having knee pain, so you can apply 4 electrodes or even 2 electrodes around the knee onto the quadricep, and then what you can do is anywhere between 15 to 20 minute time is good enough. Look for signs of inflammation. If it seems inflamed, then always go for high frequency and low intensity. If you don't feel there is inflammation, or if there is no edema or signs of inflammation, then you can go for low frequency and high intensity as well. Okay, sir, can we apply TENS in the back for a pregnant woman? In which mode? Yes, we can apply TENS. Uh, you must know TENS is one of the most safest modality in the physiotherapy uh, devices. So you can apply TENS on low back patient, or a female patient who's pregnant on the low back, even during the first, second, or third trimester. There's absolutely no crossover. There is absolutely no problem in applying TENS. You can find tons and tons of researches, but always try to keep the intensity to a certain amount that the patient is not uncomfortable with it. And in my opinion, it's always better to choose anywhere between 15 to 30 milliampere, or just under 30 milliampere. Okay, no issues, take care. Okay, sir, stroking and manipulation modes में क्या फर्क है? Furkan Ahmed, stroking and manipulation. I've never seen any mode like stroking, but it's basically tapping. So, what tapping is basically as if you are doing this. So, any stimulation that is causing a very low frequency stimulation is sometimes referred to as stroking or tapping. And manipulation, I don't know why the people call it as manipulation, because manipulate means to change something, to alter something. So there is something different, and you also need to see the manual. And it is always advisable, whenever you buy some sort of device, always go for the technical specification page, open that manual, read it first, and find out that what the device can do and what the device can't do. Ali Heather, you're asking me, sir, we can use it in chronic knee pain, or if use, so which type of TENS we use? Yes, we can use it in chronic knee pain. Of course, TENS is just a symptomatic relief. It's not the treatment. Just remember the fact, okay? You need to tell the patient all the exercises, all the steps of the treatment that are involved in it. And if you don't have interferential current, yes, you can apply TENS. Then what type of TENS? Basically, I've told you, for me, I like ComfiStim 806 model. It's really very good. You can buy anywhere, buy it anywhere in Pakistan. You can even find it on Daraz, I think, but it's very overpriced over there. So you can buy it from any medical store or surgical shop, and it's good enough. And maybe if you guys want, maybe someday I'll show you how to operate TENS, or that ComfiStim, or even the basement one, but I really don't like the basement one. Sir, pacemaker patient को TENS लगाया जा सकता है? Yes, you can apply TENS in the patients having pacemaker, but not directly over the heart or chest area. Rest of the areas are good enough. If you can, we can use TENS on pregnant women. Which effects occur? Arisha Ali, basically we just want to treat the pain, that's all. And there is absolutely no established harm. There is absolutely no established harm. People have not written anything on this, that if you apply TENS then this will happen. But because uh, if a female is pregnant, or if somebody is pregnant, we don't want to take any sort of risk, because if there is some sort of for example, miscarriage, or if she was having an ectopic pregnancy and you applied TENS and she goes home, and after a few days she come to know that she has been she has to go for a procedure because she had a miscarriage. She might think, she might abuse you, she might call you and call you names, like she may say that because I went there and you applied this and this happened. So just stay away from females, you know. Okay. Sir, how can we locate or identify the motor part stimulation for electrode placement? Okay, this is really very good. If you guys give me a moment, should I bring? You just have to wait for a minute or two. Let me bring my meridian pan. Then I'll be showing you how to locate motor point. Okay, so I'll be coming back in just 2 to 3 minutes. Be with me. So I'm back. Okay, let me show you how to find motor points. It will be really interesting for you guys. A lot of my students, they have this device, especially Dr. Hamza. Thank you very much. You've been very helpful and you're very hard working, and I wish you best of luck. And most of my students, they're really very hard working. So this is the device that is called as the Meridian Pen. Now I prefer this device because it's really very handy. It's really very good, and it's absolutely very very less costly, you know. It's really cheap, absolutely cheap. One of the best devices that you can use for electroacupuncture or for motor point detection. So let me show you how you do this. Okay, so there's this just this conduction gel. It's just an ultrasound gel. If you want to apply it for better conduction, you can apply, but if you don't want to apply it, absolutely no need. So it has just a single battery. I've inserted the battery and I'll turn it on. You can see is one and there's two. So there's one and there's two. Okay, so what I can do is, as soon as I placed it, you can see now the point where I get the most response. So this is the point where I'm getting the most of the response. Over here there is very little response, over here there is very little response, over here there is no response, there is some bit of response, and even the response is on the finger and the thumb. See, and this is the point where I'm getting the maximum response. So this is the motor point for median nerve or for the thenar muscles. So you can use this pen. It is called Meridian pen. You can inbox me and I'll help you buy this. It's, I think it will not cost you more than 1500. So this is really very good. If you need one, you can tell me. I can help you buying this. It's a very good device. Now let's move to the next question. Okay, so difference between TENS and interferential current therapy. Beta G, there are a lot of difference. Amna Arshid has asked this question. There are a lot of difference between TENS therapy and interferential current therapy. TENS is basically any therapy that involves TENS, and interferential therapy is a high frequency basically stimulation. It uses two medium frequency currents having frequency anywhere between 3900 to 4000 and even 2500 to 2600 hertz, and it always most of the time it uses 4 electrodes, and the 4 electrodes are applied in cross manner, and the two currents, they cut each other to produce the third current into the body, which affects the deeper structures. So interferential affects the deep muscles and deep tissues, but the current produced by TENS, it does not have much depth. So interferential is totally different, and it's really very costly, and TENS is really very cheap. I want to ask if TENS is specific only for nerve stimulation. No, Arifa Shehbaz, basically beta TENS can be applied for a lot of purposes. One of the main purposes is just pain relief. Yes, you can stimulate the muscle and you can improve the muscle tone and strength with it. Seema Yusuf sir, TENS only apply on back or full body pain relief. Except the eyes, the genitals, and the chest area or the carotid area, you can apply TENS anywhere, almost anywhere. So low frequency and high frequency, which frequency TENS is used mostly? It depends what kind of patients you are treating or what is the state of the pathology. If it is acute condition, always go for high frequency and low intensity. If it is subacute and chronic, you can choose from acupuncture TENS or low frequency high intensity TENS. Tell me tetanic and non-tetanic. Rukaiya Mehman. Okay, what is meant by tetanic contraction? First, I'll demonstrate a non-tetanic contraction. Let's say you have applied a TENS and there's a motor response like single contraction, single contraction, single contraction. So this is basically non-tetanic contraction. And if you apply TENS with higher frequencies, so what happens is there is sustained contraction, and that is a tetanic contraction. So a contraction that is hold for a longer period of time, or a lot of contractions or multiple contractions that mimic movement is called a tetanic contraction. Sir, can we use TENS in arthritis patient? Yes, we can use TENS in arthritis patients. It's really very good. Tabi Khatak, difference between TENS and interferential, I've already told. Vishal Khanwani, a female patient come, known case of CA breast surgery done 4 years, done now, current complaint lymphedema of left arm. Do we able to apply TENS? I don't see a reason why you can't apply it. Yes, you can apply it, but not over the chest area, but around uh, the shoulder you can apply it, or on the back you can apply it. Yes, and it will help, because whenever there will be muscle contraction, there will be pumping effect and there will be resolution of edema. So it's good. Thank you, sir. When we treat hemiplegic stroke patient, what would be the beneficial to use it, because they have no sensation? There's no, in Hilal Badr, I'm really sorry to say, most of the patients having stroke, they do have sensations, and sometimes they have hyper sensations. So a very limited or fraction of patients, they have no sensations. So you can apply TENS to the hemiplegic patient, but honestly, if you want to treat hemiplegia for motor development and motor response, go for EMS or go for Faradic stimulation, and don't consider TENS, because the primary role of TENS is pain relief. Can we apply TENS on facial palsy patients or Bell's palsy? Yes, you can apply, but again, go for EMS or Faradic or galvanic stimulation. Amna Said, ask about electrode placement and which mode is used in the management of neuropathic pain. In neuropathic pain, always find the nerve which is causing pain, apply the pain electrodes over that nerve or path of that nerve, and mode can be any mode. It depends on the state of the pathology, acute, subacute, or chronic. Information session, informative session. Thank you, Javeria. Please do another webinar on ultrasound so we could learn. Okay, I'll try to do this. How to know what is the right intensity for a patient, as it vary from patient to patient? Please guide. Yes, I've told you minimum perceptible. Minimum perceptible means patient को महसूस होना शुरू हो, that's enough. Maximum tolerable, that intensity जिससे ज़्यादा patient आगे नहीं जा सकता. And I'm making it simpler for you guys. So, and in acupuncture TENS, you can select the intensity, and patient's tolerance is the key guide. Okay, thank you very much. Bell's palsy, I've all replied already. So I have question, can you tell me reasons why TENS is contraindicated in conditions you mentioned and we all study? No, I think I've told you that why it is contraindicated, and in my lecture you can see contraindicated / precautions. So it's a long debate. I'm sorry. If you want personal answer, I can answer you. Amna Bibi, if a person have tumor at thorax level, we can place TENS on pain control. Which parameter should be? We cannot apply TENS directly over the tumor, but yes, around the tumor, you can keep at least a distance of 5 to 6 inches and you can apply. And parameters we discussed, it will be, for example, if a patient is having cancer or tumor, so try to use low frequency and high intensity. No, I don't recommend using TENS in epilepsy. I think epilepsy is totally different pathology and TENS has nothing to do with it. Okay, thank you very much, sir. Informative session. Thank you so much for answering questions. Big thumbs. Okay, thank you very much. Can we apply TENS on stroke patient in chronic phase? Yes, we can apply TENS, but always consider applying EMS or Faradic stimulation. What is it? TENS in patient with diabetic polyneuropathy. Okay, so diabetic polyneuropathy, there is sometimes there is loss of sensory sensation. So I don't recommend using TENS. What you can do is you can and I don't see a reason why you want to apply TENS in diabetic polyneuropathy. If you are working with a patient like this, always tell them to visit their physician, and most of the time they recommend methicobal. Have them understand how important is foot care, and keeping their feet covered all the time and protected all the time is really very good. And for this purpose, I don't recommend any sort of electric stimulation in polyneuropathy if the sensation is lost. आमिर मेमन सर, जो प्रैक्टिशनर छोटे बच्चों पे टेंस यूज़ करते हैं 4 to 5 months चाइल्ड पे, मैंने काफ़ी लोगों को देखा है, वो क्या इस एज में लुक पीपल डू अ लॉट ऑफ थिंग्स on their own. I have seen a few studies because till the age of 5 people say that there is no complete myelination, and I don't also recommend for children under 5 years of age to be applied or treated with electric stimulation. You just need to give them time enough to develop their nerves or nervous system, and then you can apply TENS. I personally don't recommend, and I've never applied TENS under 5. Naila Nazir, sir, it is electrical wave treatment, so it is dangerous. No, it's not dangerous because you are treating patients with a battery operated device, and the battery is basically 1.5 volt or sometimes the 9 volt battery. So, and it's a DC battery, the battery which is used in your watches, wall clocks, and things like that. So, you cannot kill your patient. Thank you very much for all the love and comments. Sir, biphasic and 4 electrode mode, which is more effective, and we can choose these two techniques. Biphasic is basically waveform. It's not a mode, it's a waveform. So biphasic means if you keep on changing the polarity, or if you want the machine to keep on changing the polarity automatically, then it's biphasic. And you can choose, because if you don't want adaptation to be or accommodation to be occurring, then you can choose biphasic. 4 polar or 2 polar makes no difference. If the area is large enough, you can choose 4 poles, and if the area is smaller enough, you can choose 2 poles. Yes, Ghania Shah, TENS can be used to treat phantom pain, but onto the distal part or the stump. We can apply in children, but not under 5 years of age. Yes, TENS can be used for treating sciatica. It's really very good. The device name is ComfiStim 806, and the other device I told you is Meridian Pen. All of those students or all of those professionals who are interested in buying device, or they want any sort of information about device, you can inbox me or WhatsApp me, so I'll tell you guys. Yes, Dr. Amanullah Nazir, TENS is effective on treating acute ankle sprain, but high frequency and low intensity, minimum perceptible intensity. You don't need to produce the muscle contractions. Thank you, Yasir bhai. I really need your prayers, and I appreciate you watching this session. Bhavna Barwani, anywhere from 15 to 30 minutes, you can apply TENS. Neck pain में TENS use कर सकते हैं. Yes. How we compare treatment outcomes in TANS and EMS? Of course, treatment outcomes are dependent on patient's response. The the targets that you want to achieve, you already know if the patient is improving or not. If you apply TANS for coccyx pain relief, it relieves the pain permanently or temporarily? TANS is just a temporary pain relief modality. It does not cure your condition. Some patient having metal implant on hand, but can we apply TANS on other part of the body? Yes, we can apply TANS elsewhere, not directly over that implant. Very informative session. Thanks from India. Thank you very much. If you are watching from India, my love to you, and I appreciate you watching me. Thank you very much. I have a lot of friends of physical therapy community residing in India. They're very good practitioner, and I respect them. I love them, especially the Sagar Naik. He's the best guy, you know. Thank you very much. If you okay, so the last question is, sir, if we use low frequency and high intensity mode of TANS in cancerous cells, as you already told in live that high intensity current may no, what I mean is high intensity is basically maximum bearable. You know, high intensity refers to maximum bearable. So you need to classify things like high frequency and low intensity. So low intensity means minimum perceptible. So low frequency and high intensity means maximum bearable. जितना patient easily बर्दाश्त कर सकता है, ये है maximum bearable. And one more thing, if you want to get your certificates, you need to answer or a few questions, and you need to go to some sort of form. I'll share the link with you guys. I'll share the link with all of you, and you can fill that form, answer your questions, and then you'll get your e-certificate. Okay, thank you very much, guys. It's been can we use TANS in muscle spasm? Yes, we can use TANS in muscle spasm to treat muscle spasm. Thank you very much, guys. When will be our next webinar? Okay, regarding the next webinar, we do have that group, electrotherapy group. I'll request Dr. Amir to open the chat for all the participants, so you can ask me and you can decide on the best topic that you want, and yes, we can plan it the next Sunday maybe. No problem with me. It's really very good, and maybe we can go for a live session rather than lecturing you guys. I just want to come in front of you guys like this, and we can have a chat session like this. We can I'll bring my modalities with me here. I can apply the modalities. I'll try to have a team with me, and I request all of you guys, if somebody is from Rawalpindi and Islamabad and he want or she want to help me in my YouTube channel, you are welcome, and you can help me. You can contact me, and I'll let you know what responsibilities I can give you, because this whole thing is on my own. So I'm doing this on my own. It's really very difficult for me to do things, and I hope you can understand. It's not easy enough. It's really very difficult. Thank you very much. Inshallah, I'll try my level best to share with you guys. Can you please tell the beneficial differences between the horizontal and vertical pattern of TANS? There is Mozam Ali Basi, absolutely no difference. You can apply any way you want. Can you do please some practical session for electric stimulation? Yes, I can do some practical session with any sort of condition you will ask me. And thank you very much. If you have nothing to say, or if you have no question to ask, I think it's time to say goodbye, because it's more than 1 hour. It's 1 hour and 16 minutes I've been with you guys. So I'll be waiting for your comments. I'll be waiting for your feedback. Thank you very much. Have a blessed day, and someday maybe sooner or later we'll discuss something really very good. Allah Hafiz.